We're going to touch a little bit on hepatitis, the different types of hepatitis. So, definition of hepatitis is going to be an inflammation of the liver, and that is usually due to a virus, but can also be exposure to alcohol, drugs, toxins, and may be acute or chronic in nature. So, the pathophysiology, the metabolic functions, and bile elimination functions of the liver are disrupted by the inflammation. So inflammation is going to damage hepatic cells and it disrupts the liver function. And this can be from an obstruction on the biliary system. Think about what we talked about with the gallbladder. This can lead to jaundice and eventually to liver damage and an alteration of metabolism of nutrients, drugs, alcohol, and other toxins. So there's going to be 5 strains here. We have the Hep A, B, C, D, and E, which we're going to talk a little bit more in detail. So hepatitis A, your transmission is going to be fecal oral. So that can be food, water, shellfish, and direct contact with an infected person. The incubation period is about 2 to 6 weeks, and viruses in the feces for 2 weeks before the symptoms develop. So that means that you could be transmitting this before you even are aware that you're infected. Onset is going to be abrupt, and symptoms can last for up to 2 months. However, once you are no longer a carrier, of the virus once it's gone. So once hepatitis A is out of your system, you can no longer transmit that to other persons. So some examples of hepatitis A. You guys are pretty young, but if you know about the restaurant Chi-Chi's, they were a chain that had to close due to an outbreak of hepatitis through lettuce contamination. So there were several deaths and the chain was sued and they went bankrupt. So it's food contamination. So hepatitis B, this is going to be your body and blood, so your body fluids and blood. For transmission, it's most commonly transmitted from mother to fetus at birth. Incubation period in weeks is going to be 6 to 24, so onset's a lot slower. And in this one, the carrier state, the person that harbors the active virus is capable of spreading it to others. So this can lead to chronic hepatitis, and then progressive hepatitis, cirrhosis, and liver cancer. And healthcare workers are really at risk from this, from needle sticks. There is a Hep B vaccine, and that's a 3-dose vaccine. So Hep C, again, body fluids, blood, injections, drug use. Your incubation period for this is 5 to 12 weeks, so relatively slow. Usually these patients are asymptomatic in nature. They're not found out till other complications are developed, and there's a lot of people, famous people that have this and are pretty open about it, like Tommy Lee, Pamela Anderson, big list of that. So primary worldwide cause of chronic hepatitis and liver cancer for Hep C. And if you're curious and want to look into it, your book doesn't talk about it, but there's a relatively new treatment out for patients infected with hepatitis C, and it's thought to be a cure. So that is really good news because this has been a chronic disease for a lot of people. When you're talking about needle sticks and things like that, I am more worried about this one than I ever would be about HIV. This is a lot easier to contract than HIV would be. It doesn't take a whole lot of body fluids to get that. Hepatitis D, so again, blood, body fluids, perinatal transmission, pretty abrupt onset, so 3 to 13 weeks for incubation. It's possible complications, chronic hepatitis, cirrhosis, and so on, and this only causes infection in people who also are infected with Hep B. So if you've got Hep B, then you can catch Hep D, but you can't catch Hep D without Hep B. Then we have hepatitis E. This is very rare. It's normally transmitted by fecal contamination of water, so it doesn't really happen a whole lot in the U.S. We've got relatively clean water sources. So incubation period's pretty abrupt, 3 to 6 weeks. And this can be pretty severe in pregnant women for complications. So think about your countries that do not have access to clean water sources. That's where you're going to see outbreaks of hepatitis C. So acute manifestations of hepatitis in the incubation phase, you're not going to really be seeing a whole lot. The virus itself is going to replicate in the liver, so this is going to cause damage to liver cells, and that provokes an immunoresponse, an inflammation, and necrosis of hepatocytes. So that's where you're going to be starting to get your manifestations there. So in the prodromal phase, before the jaundice happens, you're going to have flu-like symptoms. So that's going to be your malaise, your fatigue, your fever. Gastrointestinal, they're going to have some weight loss, some nausea, vomiting, diarrhea, possible constipation, but more likely you're going to have the diarrhea. Muscle aches, polyarthritis, and then mild right upper quadrant pain and tenderness. So think about where your liver is located in regards to the pain. So then we move on to when the jaundice happens. So they're also going to have pruritus and clay-colored stools, brown urine, and this is pretty significant, especially in more advanced cases. It's going to kind of look like Coca-Cola is what I think it looks like soda. And then they're going to move on to a phase where the patient's going to start feeling better, and that can last for several weeks. So serum, bilirubin, and enzymes are going to return to normal levels. They're going to have an increase in energy, and the pain is going to subside somewhat. So gastrointestinal, they're going to be minimal to absent effects going on there. So chronic hepatitis, that's your HBV, HCV, and HDV. The primary cause of liver damage is going to lead to cirrhosis, liver cancer, and possibly liver transplantations. With cases that are patients that are suffering from alcoholism, they are not going to be on the top of the list for liver transplantation. One of the criteria for this is being free of alcohol and drugs. So they would have to go to rehab first in order to get put on the UNOS list for that. So chronic active hepatitis, the inflammation extends to involve the entire hepatic lobes. And then we have rapidly progressive disease, and this is with HBV with concurrent HDV. Toxic hepatitis, that's direct contact with the hepatotoxic substances like alcohol, drugs, and toxins. Because remember how much gets filtered through your liver. Think about first pass effect. So the items we put in our body, if they go through the liver and they're strong, they can have a potential for causing damage. So diagnostics, you're going to be looking at your liver enzymes here. So you want to be aware that they're going to have elevated levels there. Elevation in serum bilirubin, they're going to be doing possibly a liver biopsy and looking for antibodies. So they're going to be testing for the different types of hepatitis viruses. And just make sure you know liver biopsy. So just look that up in your book and go over like the nursing considerations for that. So prevention for hepatitis A and B, there are vaccines for that. Hepatitis A is going to be 2 doses, and Hep B is going to be 3. Post-exposure prophylaxis. So this is for the patients that get exposed, that are in close contact with somebody infected. So think about a partner, a roommate, that kind of thing. They can get prophylactic treatment for that. So you want to be really looking at the people that live in the same household or that have been exposed sexually or otherwise. So with Hep A, the immunoglobulin they would be giving to treat this really needs to be given within 2 weeks of exposure. So that's going to be a single dose there. And for the Hep B, the HBIG, that's for short-term immunity. And then you want to make sure that they get vaccinated after exposure. Treatments for viral hepatitis, there's interferon alpha agent available. That's an antiviral agent, and that's going to interfere with any type of viral replication, and that's reducing the viral load. So that is going to be used to treat patients with chronic hepatitis B and chronic hep C. The side effects with this are really crummy. So all patients, and they say that all patients that get treated with this medication are going to feel crummy. So they're going to have fever, fatigue, chills, headaches, and muscle aches. You'll see nurses that have accidental needle sticks that they will be offered hep C treatments prophylactically, and a lot of times they'll say no if the patient tests negative because of how crummy that treatment makes them feel. And this is going to be used in conjunction with ribavirin, and that is an antiviral agent, and some of the side effects for these are going to be hemolytic anemia and birth defects. So you really need to make sure that with women of childbearing years that you're performing a pregnancy test on them. They also recommend that while they're on this medication that they use 2 forms of birth control, so like a birth control pill and a barrier method. It just causes a significant amount of birth defects. And recovery is quite long term, so it could take 3 to 16 weeks. Some additional complementary therapies that some people try, they will take milk thistle to help treat liver disease, licorice root, and that has antiviral and anti-inflammatory effects. Ginger for nausea, and then St. John's wort. So these patients sometimes suffer from depression, from side effects for patients taking the interferon alpha. So this one up here. Nursing diagnosis, you want risk for infection. So really, with these patients and with all patients, I can't stress this to you enough, you want to treat them all like they have some type of infectious process that can be spread, not only to protect yourself, but to protect your families and the other patients that you're working with. So you always want to use standard precautions with all of your patients. Contact isolation for these two, if they have it in their feces because of contact with the feces, so you want to expand that to the gowns, and encourage prophylactic treatment for all members of the household and anybody with intimate sexual contacts. These patients are going to have fatigue, so you want to space out your activities. With these patients, you're not going to do everything at once because you're going to really wear them out. You want to educate them on their nutrition because they're going to have less than body requirements, so high-calorie nutritional supplementation. Avoid alcohol and diet drinks and anything that's going to create a problem in the liver. So think about your Tylenols. Subsequent frequent meals to help limit nausea, and then get family involved. A lot of times the food in the hospital is not very tasty, and family can bring something in that the patients are more prone to eat. Okay, that does it for hepatitis.